All right, think about this. 30% of the inmates in the Marion County Jail right now have a diagnosed mental illness. To deal with that growing problem, police officers across central Indiana are now getting some special training. Fox 59's Eric Levy is live outside Eskenazi Health downtown with more on this. Eric.
Yeah, Fanchon, communicating, de-escalating tense situations and determining when hospitals would be a good alternative to jail. As part of the training, real-life scenarios were practiced and used to figure out a solution, I should say, to a real-life problem that seems to be getting worse by the year.
Get her out of here! What's that? It was my girlfriend, first of all. She stole all my money.
What you're seeing here is not a real incident, but these people are also not making a mockery out of mental illness. These are law enforcement officers and mental health experts coming together to learn how to better handle them.
If we can teach law enforcement personnel communication techniques and de-escalation techniques that can keep people, both the officers and the citizenry, safe, and get them to the help that they need, it's a win-win.
Sheriff deputies, EMS workers, and police officers are learning from Kimball Richardson, a mental health counselor from Community Health Network. One of the goals is to have a better understanding of how to take care of a person who has a diagnosed mental illness.
You have to be safe when we deal with it, but on the other hand, you have to look at it like if this is somebody's grandmother or somebody's brother, you have to be considerate to that and be compassionate. You got to be, understanding to what's going on. You don't know everything that's going on with somebody you walk up to, so you can't get their whole story in 2 seconds, so you have to be a little patient.
IMPD officer Greg Wilkes says over the last 10 years, the problem of mental illness has increased dramatically.
On a regular basis, if we have 10 people we deal with in a day, you're going to have 2 or 3 that are going to have some kind of mental issues going on.
The Marion County Sheriff's Department says at least 30% of their inmates are mentally ill. That number has increased over the last decade as mental hospitals have shut their doors. So this training gets patients the help they need and teaches police how to handle those situations.
This is a problem. We want to help try to resolve that little by little, officer by officer.
And if you need help, there are crisis hotlines here in Indiana, and many hospitals like Community Hospital North or Eskenazi or the IU hospitals in the group, they all have immediate 24-hour help available. We are live tonight outside Eskenazi Health downtown. Eric Levy, Fox 59 News.
Eric, thank you.
New at 7 right now, at least 30% of inmates at the Marion County Jail have a diagnosed mental illness. That's according to the sheriff's office. Well, today, law enforcement officers from all over central Indiana are getting trained in how to handle situations involving mentally ill people. Eric Levy is downtown right now outside Eskenazi Hospital. And Eric, what is this training all about?
Well, it's about how to better handle situations involving somebody who may have a diagnosed mental issue. And Eskenazi Health may be a place that police and medics can take somebody who is in that situation. And thanks to today's training, those police officers have a better understanding on how to deal with somebody who is mentally ill and diagnosed mentally ill. A mental health counselor from Community Health Network sat down with police officers and sheriff deputies and gave them tips on how to handle someone who may be mentally unstable. They did so by having people act out very real scenarios because it's a very real problem that has gotten worse over the last 10 years. One of the goals is to reduce the number of mental health inmates in the jails and instead get them to a place to get help. This training is important.
You have to be safe when we deal with it, but on the other hand, you have to look at it like if this is somebody's grandmother or somebody's brother, you have to be considerate to that and be compassionate. You got to be, understanding to what's going on. You don't know everything that's going on with somebody you walk up to, so you can't get their whole story in 2 seconds, so you have to be a little patient.
We will dig deeper into how bad this problem is, but also the fact that there is help available. Turn that story around for you tonight at 10. Reporting live downtown, Eric Levy, Fox 59 News.
All right, Eric, we'll see you soon.